My name is Aubrey Mentis, and I'm with United Way of the Plains. I am the new Community Health Impact Manager. Today I have Taben Azad with the Wichita Asian Association. Taben is here to discuss with us today about an upcoming event. Before you do that, could you tell us a little bit about your organization?
Yeah, so I'm a part of the Wichita Asian Association. It is one of the largest organizations in the state of Kansas that works to support and serve as a representative for Asian Americans and Pacific Islanders in the community. We're most famous for our Asian festival that we host, and we get over 10,000 people that attend that event.
Taben, could you tell us a little bit about upcoming Asian Health Fair, which will be on October the 15th? Is that right, Taben?
It is on October 15th. We're excited to have our first ever health fair for specifically Asian Americans in the community, and we're expecting a great turnout.
Awesome. Could you tell me a little bit more about what are some of the highlights of the health fair is going to be, please?
Yeah, so we're excited to have health professionals from all types of fields, and specifically we targeted Asian American professionals. We know that representation matters a lot when it comes to health inequities, and being able to see someone that looks like us and has the same experiences was really important. And so we'll have people that are dentists, optometrists, mental health therapists that are all Asian American, and we'll also have translation services. That's another big piece to the health fair.
That's awesome. So during the fair, would individuals be able to obtain any services? Dental services?
Yes. So they'll be able to get services, screenings, and just general information for follow-up, and all these are provided for free. That's the big piece. We want people to feel like there's not a financial burden on them to get a screening, and if there's follow-up necessary, we want to create that relationship between them and the professionals that are there so that they can follow up and get their teeth checked out even more, or hopefully get another screening if they do need to get an optometrist prescription, if that makes sense. Yeah.
Awesome. Now, what are the times for the event?
Yeah, so the health fair is on October 15th. That's a Saturday, and it's from 2 to 5 p.m. It'll be at Century 2. It happens right before our annual Wichita Asian Festival, and that's on purpose because we get so many people to come to the festival. We want to take advantage of that attendance and hope that people that come to the festival can get a screening right before coming in and enjoying the rest of the night.
Awesome. That's a great idea. That's a great plan. In fact, I'm planning on attending
awesome.
for the food service.
Oh, definitely.
Initially, I was speaking with the wife about it last night, and she's like, well, yes, I'll be there.
Yeah.
So with the Promise on the Plains, which is one of our campaigns that we generally promote, it's an equity campaign.
Yes.
Could you elaborate on how that was able to make an impact with your organization?
Yeah, no, that made a huge impact for us. Being able to receive that grant specifically to address health inequities within the community was important because we had to make sure that we had those resources that were available for the people that are attending the health fair. And those resources we've talked about a little bit earlier, those translation services, having resources and information actually translated before the event itself so that people know that this was going on. People who don't speak English as their native tongue, being able to see something translated in their own language, makes a huge difference. They can see what's going on and understand on this date you can expect this kind of an event. And so the grant that we received is helping with just that. It's going to help make sure that a lot of people are there, not just from one community, but diverse communities within Asia, because Asia consists of so many types of people, so many ethnicities, and so we wanted to make sure that we had as many translated services as possible.
Awesome. I was thinking, with putting this together, how many of our community partners were able to get involved? Did we able to collaborate with other agencies out there?
We have a growing list of people that are collaborating with us. There's a few other nonprofit organizations in the community that work towards Asian American services and projects, I guess, and so they're getting on board with us as well. We have a few clinics that are in the community as well, so Guadalupe Clinic, the Mayo Clinic, who have reached out to us for interest in being at the fair. You don't see a fair like this very often for Asian Americans, and so I think there's a lot of excitement around this event, and so we welcome it, we're happy to have it, and we're excited.
Awesome. What was the response like for these organizations when you reached out to them? I thought you said that some of them were very excited, but for the most part,
Yeah, I think there's been a gap in our ability to reach out to the Asian American community, and a lot of people have reached out to us before in the past to see what we can do to collaborate. Having this event really generated that excitement. It's been long needed, it's been overdue, and so really that excitement is there, which is why I'm confident that it will be a great turnout.
Now, I'm curious, how does language barriers has an impact on an individual's quality of healthcare or access to healthcare?
Yeah, that's a great question, and that's probably the biggest question that we're trying to answer with this health fair. Because when you go to a doctor, when you go to a dentist, being able to communicate what you're going through and what you're feeling is the main point of that appointment, right? And if you're not able to communicate that well to your doctor, chances are you're not able to get a remedy or a cure for what you're going through as adequately as you need it to be. And so we found that translation piece, if we're able to communicate well, we can certainly make sure that any concerns or any issues of feeling comfortable are alleviated because you are being able to speak in your native tongue. You're able to communicate clearly to your professional about what's going on.
That is awesome. I think that would be a really great opportunity for a lot of individuals who are not able to get access to healthcare because of that language barrier, to be able to get those services. So I think what your organization is doing is going to be really impactful for our community. And I'm very glad you guys are doing that. And how would you propose that you might be breaking these barriers, or how?
Yeah. That's a great question. Yeah, I think the first step was being intentional about the professionals that are at the health fair. Okay. I mentioned earlier that if you see someone that looks like you as your doctor, as your dentist, as your optometrist, that makes a huge difference. You're more comfortable and more willing to engage with that person. Because we've noticed that preventative health care is a lacking part to the Asian American community, this event really bridges that gap. It gets people to get screens, get services, and then from there, they're able to address much more major things that might be going on with their health system. So that preventative healthcare piece through this health fair really is the key to make sure that they do have a long, sustaining life, that there aren't issues that they need to address later on. If you think of it from a dental perspective, if you get a cleaning, you can avoid your root canal, right? And so that's what we're trying to do.
Okay. That's an interesting thing that you said just now, because the health disparity often, the word is being tossed around a lot. But getting people to understand what it actually is and how it impacts a person's life is very challenging. Does the Asian American Association have steps to get more allies and co-conspirators on board?
Yeah, I think that's definitely a conversation that's ongoing. A lot of coalitions and community partners after this event, I'm sure, will make notice of what we're trying to do. In the past, we haven't made this headway within health inequities, but that's certainly been the focus with this health fair. And I think based off of this event, we're expected to get that collaboration, that partnership with other organizations to go up, to increase. Yeah.
Okay, great. Taben, I want to thank you again for taking the time to share with us the exciting news for the new program, the Health Equity Fair. Could you remind our audience once more what dates and the times for the event?
So the date of the health fair itself is on October 15th. It's a Saturday, and it's from 2 to 5 p.m. at Century 2. Right as you enter, you will see that area, the lobby area, being utilized for the health fair. It's hard to miss, but it'll be on October 15th.
Okay, and we hope to see you all there.